Welcome back to Kenton and Habiba. Habiba here. So I'm gonna start off this video telling you a little story. So the other day I went outside to pick up the mail, and lo and behold, there was an envelope from AARP. So I was like, this has to be a mistake. This has to be a mistake. Why is it coming to my house? AARP is for old people, right? AARP, it used to stand for American Adults, AARP, retired people. That's what it stood for. I remember AARP is something I would see with my grandmother. My grandmother would talk about her AARP mail. And so again, in my head, old people stuff. So it has to be a mistake if it's coming to my house, right? So I checked the envelope, it's got my name on it. And I'm like having an out-of-body experience. Why does it have my name on it? Foolishness. Why are they sending me AARP mail for old people and has my name on it? So anyway, I take the mail and I go inside the house, and my first instinct is to tear it up. Because I was like, it has to be a mistake, right? And then I realized, my God, you have turned 50. You are now 50, and by traditional standards, you are old. But clearly, I do not feel old, right? I don't feel old. I don't look old. I don't act old, whatever the traditional or old-fashioned view is of being old. So that leads me to today's video. We're gonna talk about menopause and all the things to expect as you get older, when you get to that certain age. And I was gonna make this kind of funny, but you know, I also have to keep in mind that I am a medical doctor, so you want some level of substance from this video, right? It's not just about funny stories. I wanna teach you something or remind you of certain things. So that's what this video is going to be. The good, the bad, the ugly about getting older. And some of these things may happen or have happened to you even before you turn 50. For some people, I mean, I am lucky. I'm one of those people where most of these menopause symptoms have not really affected me personally, but certainly as a physician, I've had to treat people with certain symptoms of menopause. So before we talk about some of the positives, because there are some positives of getting older, let's talk about some of the uncomfortable or negative effects of getting older. And if you are a woman, you may have experienced or you will experience some of these symptoms at some point in your life. So again, let's talk about menopause. What exactly is menopause? Menopause usually happens on average at around age 50 or 51 in the United States. But on average, it can happen between the ages of 45 and up to 55 years of age. So it usually suggests the diminished amount of estrogen and progesterone in your body. So some symptoms of menopause, or how you would know you're going through menopause besides your age, is that you might have a cessation or decrease in your period. So instead of having periods every month, your periods will start getting less and less and less. So they may become irregular. So one time they might be super heavy, and other times it might just be spotting, and they are not as frequent as they used to be in most scenarios. So menopause is really generally considered when you have gone almost a year or a full year without having a consistent period. So if you are going a whole year and you don't have a period and you're over 45, you probably went through menopause, okay? Other symptoms of menopause are hot flashes, mood swings, and going back to the hot flashes, these hot flashes might make it difficult to sleep. So you might also have insomnia. Insomnia means difficulty sleep, right? Hot flashes. I remember my grandmother walking around talking about she was hot, she's hot, shot. Doesn't matter what time of day, she was always hot. But a lot of times hot flashes happen at night. Going to sleep, you're trying to sleep and you're just sweating profusely for no good reason. Everybody else is cool and comfortable and you're hot. Sometimes you just have joint pain for no good reason. You know, everything starts to hurt. You just get up and your joints hurt. Or older people talk about, oh, I'm in pain, I'm achy, and I have, you know, there's no good reason for it. But honestly, menopause is one reason why you might have joint pains. Of course, you should make sure you get that evaluated, because joint pains in itself can mean many other different things. You know, it could be due to arthritis, for which you might need medication. It could be due to some other medical problem, but it's not uncommon to see joint pain during menopause. Another symptom that, you know, women don't like to talk about, but as your doctor friend will talk about, is also vaginal dryness. So vaginal dryness can be a very significant and uncomfortable symptom for women going through menopause. And because that can cause difficulty or painful intercourse. Obviously, you know, if you're grown, and this video, by the way, is for grown people. So if your children are watching this, tell them to come off. Tell them to come out the room, because this is going to be grown people's talk. But yeah, vaginal dryness is due to the fact that you have lower levels of estrogen. And so you have less blood flow to your vagina and to your vulva, and also less lubrication in that area due to menopause. And so it makes intercourse sometimes painful. It can also make the vagina a lot shorter. So, you know, there's the length, there's the cervix, there's the length of the vagina, where you have intercourse, and that area can get shorter and also smaller, which can also make intercourse painful. But that does not mean you should stop having intercourse. Oh no, in fact, you should continue to have intercourse. That way some of those changes like the shortening and the shrinking don't happen. So I'm encouraging you, keep having sex. Menopause is not a reason not to have intercourse. Another symptom of menopause is frequent UTIs, and I believe that goes along with also the reduced estrogen, and it causes, you know, the lining of the vagina and the urethra tends to be a lot thinner and more prone to damage. So make sure if you are urinating too frequently that you check with your medical provider to make sure that you don't have a bladder infection, because they can lead to serious problems, especially women as they get older. They may not have the typical, you know, discomfort down there, suprapubic discomfort. It might just be a fever. Some people may not even have a fever. They'll just have a strong odor to their urine, and notice that they're urinating frequently. Of course, diabetics may also urinate frequently, but just make sure if you're having suprapubic discomfort, urinary frequency, maybe a fever, you may not even having a fever, or the odor has changed, or it looks different, that you also check with your medical provider. Another thing that happens frequently in menopause is what they call brain fog, or cognitive changes, where you just feel like your thinking is not as sharp, or you feel like you're forgetful, more forgetful than normal. You're having a difficulty remembering things or following through. That is also common with menopause. Not to say every woman going through menopause goes through that, but that is something that is not uncommon. So what causes menopause, right? What causes menopause? I mean, the general answer is that there's a reduced amount of estrogen and progesterone, right? So where does estrogen come from? You know, where does estrogen come from in your body? Well, estrogen comes from your ovaries. Majority of it comes from your ovaries, but some of it also comes from your adrenal gland. Some of it comes from the placenta. So for women who have had children, you know the placenta is a source of nutrition for your baby. So there's also some levels of estrogen in the placenta. But primarily, most of the estrogen comes from your ovaries. So reasons that you may have gone through menopause besides your typical could be if you've had chemotherapy. So chemotherapy or radiation may destroy the ovaries, and that can send you into early menopause. Also, there is what you call premature ovarian failure, where your ovary fails to make estrogen anymore. And premature ovarian failure is considered premature if it's before age 40, because typically, again, most women go through menopause after the age of 50 or 51 in general. But if you're going through it at the age of 40, then that's considered premature ovarian failure. Another reason for going through menopause might be because you've had a hysterectomy. And when I say hysterectomy, I mean a total hysterectomy. So you know there are different types of hysterectomy, right? But if you've had a total hysterectomy and they took out not only your uterus, but they took out your ovaries for whatever reason, then you might go through, or you will go through menopause, because now you don't have ovaries. So a lot of times, if the reason was not for cancer, you might be offered, Premarin or some sort of hormone replacement. And that depends on your discussion with your doctor, and also depending on your risk factors. Because if you have any kind of cancer in your family, or history of cancer yourself, then estrogen replacement is not an option for you, or should not really be an option for you. You need to look into natural methods or natural alternatives to the pharmaceutical drugs. So I've told you where estrogen comes from in your body. I've told you some of the symptoms of menopause, and I've told you the reasons that you may go into menopause despite natural aging, or besides the natural aging process. So do you know that men also have their own type of menopause, or their own version of menopause? Yep. So your boyfriend or your husband, he might be going through it too. But yeah, for men, they may have loss of libido over time, but their changes are very gradual. It's not as sudden or as abrupt as women. And it happens because they have less testosterone being made or being produced. So they can have reduced libido due to diminished amount of testosterone. They get belly, no more belly. You can let those young girls get belly, not you anymore. Kind of related to number one, you can have sex freely and not worry about getting pregnant.